The finding of this year's World Drug Report shows that the drug markets are expanding, with cocaine and opium production hitting absolute record highs, presenting multiple challenges on multiple fronts. Drug trafficking online using the darknet is growing rapidly. At the same time, the sheer range of drugs and combinations available is unprecedented. New psychoactive substances continue to proliferate, and methamphetamines are spreading outside their usual markets. We're increasingly seeing substances of unclear origin moved through illicit channels sold as medicine and destined to non-medical use. These threats to health and safety posed by these developments are clearly alarming. Non-medical use of prescription drugs has reached epidemic proportions in some parts of the world. The opioid crisis, in particular the use of fentanyl and its analogs, has contributed to a 21% increase in the number of drug overdose deaths in the US to more than 63,000. The report also finds that the downward trends in Europe in opiate use appears to have come to an end. More concerning still is tramadol addiction, levels of which are soaring in some parts of Africa. Tramadol is not under international control, and most of tramadol seized worldwide is illicitly supplied, originated from clandestine labs in Asia. West, Central, and North Africa accounted for 87% of the global seizures of pharmaceutical opioids in 2016. This is affecting highly vulnerable populations and regions where healthcare systems are not able to cope. Globally, some 450,000 people died in 2015 as a result of drug use. Of those deaths, 167,750 were a direct result of drug use disorders, in most cases involving opioids overdose. Treatment and services continue to fall short in the face of adverse health consequences caused by drug use. It is clear that if we want to help countries get to grips with opioid threats and other drug challenges, we need to expand the availability of evidence-based prevention and treatment services. UNODC is working with WHO and other partners to promote such action in line with International Drug Control Conventions, the UNGAS Outcome Document 2019 Political Declaration Plan of Action, Human Rights Instruments, and the Sustainable Development Goals. This includes advancing international standards on drug use prevention, as well as international standards for treatment of drug use disorders. We're also supporting guidelines on treatment and care for people with drug use disorders in contact with criminal justice system, and scaling up core interventions to help prevent and the spread of HIV and hepatitis C among people who inject drugs. The World Drug Report 2018 highlights the importance of agenda and age-sensitive drug policies which can help to further target responses. In particular, a focus on breaking the chain of social, neurobiological, and psychological factors and inequalities, increasing the susceptibility of young people to drug use disorders can support effective prevention and contribute to achieving SDG targets. To address the global opioid crisis, UNODC has recently launched its new integrated and multidisciplinary strategy to further step up our support to countries. This initiative includes addressing international control of substances and law enforcement efforts to tackle supply, as well as initiatives to promote use and access to opioids for medical scientific purposes, while preventing misuse and diversion, all of which are crucial to addressing the threats posed by synthetic opioids. The project also seeks to go beyond the current crisis and strengthen prevention platforms, including through early warning systems. At the same time, UNODC remains fully engaged in supporting governments to address record level of opioids and cocaine, including through promoting sustainable alternative development. UNODC stands ready with Colombia and Colombian government in addressing the scourge of illicit drug industry within the longer-term objectives of building sustainable and equitable peace. Deep structural development reforms take time, and perseverance, therefore, before their results can be appreciated, is necessary. I just briefed the UN Security Council on our efforts with Afghanistan and neighboring countries, including through UNODC's strategic action to respond to global threat of opioids initiative, SATO. This national, regional, and interregional approach aims to support comprehensive and holistic responses encompassing activities focusing on drug demand and supply reduction, alternative development, and crime prevention. Mr. President, ladies and gentlemen, UNODC is committed to working with countries to seek balanced, integrated solutions to drug challenges and achieve progress towards sustainable development goals. The World Drug Report represents a key pillar of our support, along with assistance to translate international obligations into action and capacity building on the ground to enable effective responses and protect the health and welfare of humankind. I hope that this report findings serve to promote further discussion, informed policies, and strengthen international cooperation. And UNODC is here to support you. I thank you.